Athletic training specializes in preventing, diagnosing, and treating muscle and bone injuries and illnesses. While qualified in doing so, many athletic trainers still get undermined. In an attempt to open the eyes of the general populations, we caught up with some certified athletic trainers and athletic training students from Hardin-Simmons University.
I guess you're right, and there's nothing I would say to you this time. You told me just what I had to live for, and there's no flight in my fight, and more than that, it's so alright, it's so alright. If I meet more than your eyes, I guess you're right. If I wake up in your mind, I guess you're right. I guess you're smart, 'cause I'm taken by you, taking me apart. I could best believe.
What are your duties as an athletic trainer?
Well, a typical day is it varies during season. During football season, we have early morning treatments. So we'll have an early morning clinic from 6 to 8, where we'll see patients for rehabs and treatments and injury evaluations from practice. And then from 6 to 8, that's all we do. And then may take an hour break or so to go and take care of some things personally, but then the rest of my morning is spent doing administrative duties, mostly with insurance agencies, visiting with them about a current claim that may be out, or visiting with our insurance company, scheduling doctor's appointments, maybe writing policies, reviewing policies. We have staff meeting once a week, so preparing for staff meeting with the other athletic trainers on staff. So that's a typical morning during the fall. And then in the afternoons, obviously during the fall, we'll go to practice. Any other odds and ends that need to be taken care of. As the director of the sports medicine program on the athletic side, there may be a lot of fires that need to be put out administratively between other athletic trainers and situations that come up at their facilities, or with scheduling conflicts or doctor's appointments, things like that. So it doesn't vary too much from the fall to the spring, other than practice schedules. Practice schedules kind of dictate where when we come into the office and when we leave. And so during the spring, we have men's basketball practice. They typically will practice in the evenings. So the day's a little bit longer, so to speak, on certain days. But really, the spring is a little less hectic than the fall.
Some of my duties as an athletic trainer here at Hardin-Simmons are twofold. We have patient care, so we take care of athletes here at Hardin-Simmons, and also I'm a preceptor, so we do clinical education and instruct our students who are in our athletic training education program.
Some of my duties as an athletic training student in this clinic are to evaluate any injured athletes that come in, and then after we evaluate them, we are in charge of overseeing their rehab and doing all their exercises with them. And then in this room right here, we do all of our documentation for any rehab exercises that we do, any modalities such as ice or hot pack that we do, and also document any evaluations that we do, whether it be gen med or orthopedic.
Some of my duties as an athletic training student are to sit in class and be educated about the different injuries that might occur during sports and how to diagnose those injuries through diagnostic testing, and then how we would treat those injuries where we use ice, electrical stimulation and other therapeutic modalities, rehab for those injuries, and also just how we can help those athletes return back to normal so that they may return to their sport that they love.
Well, a typical day for student athletic training it starts early, before even the athletes consider coming to the locker room. We get here, we fill up water bottles, we fill up coolers, we get the kits stocked and everything up. And then the athletes start coming in, we do pregame treatments, so we start warming them up, stretching them out, and then generally we have practice or the game, and then we actually stay later than most athletes because we have to deal with all the injuries afterwards. So a typical day is long, tough, but absolutely worth it.
What are some common misconceptions seen in athletic training?
I think some common misconceptions about athletic training is one, we get confused with personal training. Although I do have a background in some aspect of weight training and rehabilitation, that is not my primary goal. I think another misconception about athletic training is that all we end up is just handing out ice bags or maybe taping people. There's really a lot more that goes into what we do, the prevention of injuries, the treatment of the athletes, the rehabilitation, emergency care. There's just really a lot of things that we do, just not those things.
That's a good question. Some common misconceptions that I see is that we're generally only known for tape jobs. We're just supposed to tape ankles, wrists, fingers, knees even, but that's not true. Often we're dealing with prevention programs, rehabilitation, and that also leads into another misconception that's often construed, in which coaches and athletes, not all coaches, not all athletes, but believe that we're just here to prevent athletes from continuing their sport. That's not true. We're here to help them, but mainly to prevent them from causing further injury. And the only reason we would refrain athletes from continuing in a sporting event is if we believe that they would continue to hurt themselves.
Some common misconceptions about the athletic training profession is that we are just trainers who carry around water bottles and tape people up when they need to be taped. But in actuality, our job description encompasses a whole lot more than that. We do injury prevention, injury diagnosis, and rehabilitation. We do return to play. We're also there if the athletes have any problems during practice or games.
I'm pretty new to this, but from everything that I've seen, sometimes we don't get enough respect from athletes or coaches because they see that we're just a college kid or we're just learning these things, but they don't think that we can apply what we know and it be relevant to whatever's going on. And a lot of the times people think we're just here to pass out water or a towel or just tape people up before they go play their sport, but that's not the case.
Some common misconceptions of athletic trainers is that all we do is hand out water and give out ice bags and tape ankles, which in all reality that is not true. We're there to take care of the athlete once they get injured and then help them return to play with whatever that may take.
I think some of the things that are misconceptions are that we just tape ankles or we hand water out or just hand somebody ibuprofen and say, have a good day. I spend 75% of my time doing rehab with athletes, doing treatment with athletes, trying to get them better, and then just the other 25% is spent at practice or working with them outside of the clinic. So much of the outside world's idea is that we just are here to tape an ankle and not really treat an athlete, but I treat a lot of athletes.
The biggest misconception is with the public is they use the term trainer a lot. Oh, you're a trainer. And people don't understand, what that is, what the definition of it is. And it may be perceived that we're a personal trainer that works in a health or fitness avenue. Or it may be that we're a yoga trainer. There's a lot of different definitions of what a trainer is, but the athletic trainer itself, there's a lot of misconceptions. The most common misconception is that, we're the guys that tape and hand out water bottles. Well, those are two big components of what we do. That is not the definition of an athletic trainer. The athletic trainer is a healthcare professional that provides immediate acute injury care management and rehabilitation and treatment to long-term injuries. So as a whole, I think there's a significant difference between what the public knows and what is actually done by an athletic trainer.
Check out Looking Through the Eyes of Athletic Training Part 2 as we take a look at what the future holds for athletic training.
Yes, we are.